Majority of the people will have constipation.
As you grow old, the gut motility comes down.
What might be the reasons?
The low fiber content that we are having. Most of the fast foods that we have, zero fiber content.
A lot of people will also having bloating,
Having a very high calorie diet.
sleep and gut issues.
The gut-brain axis. Most of gut-brain interaction happens when you are at rest. If your sleep gets disturbed, your gut gets disturbed. Your gut gets disturbed, your sleep gets disturbed.
Steve Jobs, he died because of pancreatic cancer.
The tumor has already gone into a stage where it is not curable. Quite an aggressive disease as such, pancreatic cancer. So it has to be picked up early.
Fatty liver. And why do you think it's becoming so common?
Sedentary lifestyle and lack of exercise, physical activity, packaged food is mainly causing this.
Gallbladder stones, and if it is too extreme.
You don't remove the gallbladder for every person who has gallstones. So removing a diseased gallbladder is not going to affect you in any way. Stones are causing some symptoms, causing some jaundice.
How good is intermittent fasting?
They should start with a smaller interval.
Hi friends, welcome back to our podcast. I'm Dr. Vani, and in today's podcast, we have a surgical gastroenterologist, Dr. ABILASH Prasad. Welcome to our podcast, doctor.
Thanks for having me.
As you being a gastroenterologist, have you seen patients who had to have surgeries just because they ignored their gastric symptoms for years and years? If they would have not ignored their symptoms, they would have happily been treated with medicines. Are there any such cases?
Many cases like that are there, but more than that, I would say that delay in the diagnosis and delaying the treatment has actually caused more complicated surgeries. So patients come in a state where the surgeries become more complicated and more risk to them and everything. Couple of scenarios I can suggest. One is as far as colorectal cancer is concerned, which is very common in India these days. There is something called as adenoma-carcinoma sequence, where it first starts as an adenomatous polyp and later on becomes a cancerous growth. So if the patient had come earlier and we could have done a colonoscopy and removed the polyp, and if it was in a precancerous stage, the entire surgery could have been avoided. In the same scenario, suppose the patient is having gallstones and the patient is symptomatic, definitely a surgery is required, but an early surgery would have prevented much more complications like the stone slipping, causing severe pancreatitis, patient needing ICU admission, all the extra cost, everything could have been saved there. So definitely if the patient comes early, it's much more easier for both the doctor and for the patient.
As you said, like sometimes people either are they're not sure whether they should have a surgery.
Yeah.
They might be scared to get surgeries, or
Yeah.
they might be hopping, doing hospital hopping,
Yeah.
like whether I should get surgery or not, and all these things, which will make them get delayed with their treatments and all.
People are scared of the surgery. If they come earlier, the surgery would have been simple. They could have been
Yeah.
discharged in a day or two.
Yeah.
And in some cases, yes, it could have been avoided also.
I mean, like if they are doubtful whether they need to
Yeah.
have a surgery or not, at least maximum 1 or 2 opinions they can take and then
Yeah.
get ready for
The
rather than
problem is
delaying.
self-medication. So a lot of people self-medicate themselves and the real diagnosis is missed by the time it's too late to treat also.
Yeah, that is also a thing, like self-medications and
Yes.
all that. Like, and one more thing, doctor, as you said, self-medications. A lot of people pop in like antacids
Yeah.
and gelicidin syrup and
Yes,
all these,
yes.
digen
Yes,
syrup and
yes,
all these
yes.
things. So, do you think that a lot of people are, rather than treating themselves for acidity, do you think they are damaging the stomach lining by using all these medications?
In some patients, the antacids like pantoprazole, all these are essential for a brief period, maybe for a few weeks or something, but most people don't need. So we have to treat the root cause of why the patient is having those symptoms instead of jumping straight to block the acid. So acid as such is needed for our digestion. Around 10 to 15% of our digestion happens in the stomach. And this acid is very essential in breaking down proteins, starting the digestion of proteins, complex proteins. And there is also something called as intrinsic factor, which is required for vitamin B12 absorption. So once you pop in these antacids, it blocks this intrinsic factor. So patients develop vitamin B12 deficiencies. Also suppressing the acid for a long term, not only reduce the digestion as such, it may also delay the diagnosis of some more complex diseases. So I've seen many patients over 60s, 70s who are popping antacids and they come for an endoscopy and we find some sort of growth, gastric cancer, and it's already too late. So that is a very common scenario. So if you're having persistent acidity and bloating symptoms beyond 2 to 3 weeks, you have already tried this antacids, I think it's time to consult your doctor.
Okay. So once or twice is okay, but not long term.
Yeah. If it is persistent, your self-medicating is not the right thing to do, because you have to address what is the source, what is the root cause of the problem, and addressing that will treat your problem, whatever it is.
Yeah. So even like taking Digene also is dangerous.
Yes, definitely. I mean, it just gives you a symptomatic relief for the time being, but if the root cause is not addressed, sometimes it might be some H. pylori infection which is causing some ulcer disease. The course of antibiotics for 2 3 weeks will cure your disease. So instead of that, to keep on popping antacids and all this will only make the symptoms worsen.
Having such kind of acidity symptoms
Yeah.
for more than 2 or 3 weeks, or you having it, like some people suffer with acidity,
And
like
the other thing is that most people call everything as acidity. So we don't know exactly what they mean by calling it as
correct.
acidity.
Yeah.
So once you consult the doctor, we'll be able to know what exactly they're calling it. Maybe they are telling some abdomen pain, or they're talking about some flatulence and all those things. So that the entire diagnosis changes.
Correct.
Yeah.
Like acidity is such a common, broadly
acidity
used
and gas are very common terms, layman terms. So once you take a detailed history, you know that they are meaning something else altogether.
Yeah, so whoever is suffering with acidity or gaseous symptoms for more than 2 or 3 weeks, better to consult a gastroenterologist.
Yeah, definitely.
Yeah. And moreover, doctor, like these days, a lot of people, I think since the last decade, a lot of people are into dieting and all these things. So
Yes.
people are into crash diets and all these
Yeah.
things. So how does this crash diets affect their GIT?
Main thing about crash diet, what exactly does crash diet mean? It means you are following extreme diet plans to reduce your weight. So in the short term, maybe if you check yourself in the weighing scale, maybe there might be some significant weight reduction. So, but most of these crash diets, there is something called as rebound weight gain. It's not sustainable for a long time for any person, and the person is likely to get a rebound weight gain after some time. The other thing about these crash diets are that our gut has a lining of microbacteria, the good bacteria which are essential for your overall health, not just the gut health. Now studies show that entire the gut-brain axis, your entire mental health as well is attributed to the gut microbiota. And this gut microbiota requires a constant source of nutrients and a mix of fibers for sustaining itself. So unless it sustains itself and helps in protecting this gut lining, there is potential source for causing severe gut inflammation and serious side effects because of that. So all these crash diets that these influencers are prescribing should be taken cautiously. I think you should do your own research before starting on such diets, or probably consult a certified nutritionist or a gastroenterologist before you start yourself on these crash diets. Wouldn't recommend, and other things that each person is different. So to give one prescription for everyone that this is going to be beneficial is not right.
Correct. The other day in a podcast with a plastic surgeon, like he was mentioning that a patient was into extreme over healthy diet and all, and he came with a swelling after hair transplantation. Like within 1 or 2 days, he came to the hospital with a complaint that he has face swelling and all.
Okay.
And they did the history and everything he was doing normal, but only thing, he was having multiple times green tea, extremely healthy diet and all that. So over healthy diet and all this,
even the green tea, it has got these antioxidants that is actually beneficial for your health, but you take more than 4 to 5 cups, it is toxic to the liver. So a lot of people see all these, the way in which green tea is being promoted. Actually, it is healthy. It has a lot of good antioxidants, which is good for your health. But you take it beyond a certain point, it is not good. It might backfire on you. Actually.
Yeah, that's what. That's what. Too much dieting, too much healthy diet.
And all these crash diets, they don't have a specific prescription. They go to such extremes, and in the process, you might actually lose some muscle mass also. Your weighing scale might show that you have lost weight, but we don't know how much of it is the fat you have lost, and over a period of time, you might lose your muscle mass also. Yeah,
and it will affect their functionality and all.
The lean mass will be lost, and just like how a patient with cancer will have sarcopenia, slowly the muscle also starts getting used for creating the energy that is required for the basic body functions.
Correct. Yeah, that's why people whoever is going on crash diets and they'll always be cranky,
Yeah.
frustrated and all.
Yes.
And moreover, doctor, like as you are telling about, we are talking about diet and everything. If a person is taking healthy diet and following a healthy lifestyle, can they prevent gastrointestinal surgeries or any gastrointestinal diseases for that matter?
A lot of gastrointestinal diseases that come today are lifestyle related. To a lot of extent, a healthy diet and a healthy lifestyle will prevent most of the diseases. For example, fatty liver, which is very common these days. The main reason is related to not having a proper exercise, the sedentary lifestyle that we are all following these days. That is the main source of fatty liver these days. Similarly, the colorectal cancer, which is rising these days, it's attributed to the kind of diet we are having, which is low in fiber. So all these things, multiple health issues can be prevented if you have a healthy lifestyle.
Fatty liver, like normally earlier days, like when I was studying and this medicine and all, like fatty liver means alcoholics are prone to fatty liver and all.
Yes.
But these days, even non-alcoholics
Yes.
are getting fatty liver.
Yes.
Everyone, even women are getting fatty liver. So why do you think it's becoming so common? Just because of this lifestyle and all this?
Yeah, previously alcohol used to be the number one cause of fatty liver, but these days non-alcoholic fatty liver disease has taken over. It's become sort of a pandemic. So if you see in my own OP sitting, around I say high as 70 to 75% of the people who come with an ultrasound report will have a report of fatty liver. So it's mainly related to the lifestyle that we are having these days. Most of us have very random schedules, work hours, and most of us sitting all day. When we come back to our house also, we are sitting in front of Netflix or Amazon, and the sedentary lifestyle and lack of exercise, physical activity is what is mainly causing this fatty liver. The other thing is all the packaged food, the sugary drinks that we are having, all the Coke, Pepsi and all those things also attribute to the fatty liver. So if you change your lifestyle as such, if you bring in at least 1 hour of exercise a day, it is something which is reversible also.
So is this fatty liver kind of like dangerous kind of disease? Like do they have to take medications for lifelong or something?
Fatty liver has multiple stages.
Yeah.
So initial first 2 stages are quite reversible. If you change your lifestyle and there are certain medications that your gastroenterologist might prescribe for a few months. You don't have to take it lifelong. At these early stages, it is reversible. But once it goes beyond that into the stage of fibrosis and cirrhosis, it is irreversible.
Okay.
So it is dangerous in the way that it can progress to cirrhosis, which can cause liver failure. And it also increases the risk of liver cancer, the hepatocellular cancer also.
Oh, is it? Because fatty liver has become so common these days.
Yeah.
Like people are like just, I have fatty liver. They're just starting to like take it light.
The other thing is that a lot of ultrasounds report it as fatty liver. But to know the exact extent to which the liver is damaged, we need to do further testing. We need to look at your liver function test. And also there is a test called elastography, where you assess the liver stiffness and to what extent the fatty liver has affected the liver function and everything. So if you have diagnosed fatty liver, it will be better to go for the next level of investigations where you look at your liver function test, to what extent this fatty liver has affected your liver. And according to that, some people need some medicines along with the lifestyle modification. But there is a lot of time before it goes into stage 3 and stage 4. So I would say it is largely preventable.
Yeah, stage 1 and stage 2.
Yeah, it is a reversible thing. So
panic.
I think it's never too late for you to change.
And do you think, is it because of eating too much, non-vegetarian animal foods, this fatty liver occurs?
Yeah, a lot of this processed food, basically the high sugar content will cause liver to more cholesterol to accumulate within the liver. And even all these tests, only after a certain level of fat accumulation, only these tests are detecting this fatty liver. So which means that the insult has already happened since a long time before it is actually coming up in a scan. So it's better that you take steps to reverse it at an earlier stage.
Is there any age limit? Like, is it like only people after 40, people after 50 are getting 40 fatty liver?
No, that is not true. People, even in their teenagers, are
Oh,
getting
is it?
fatty liver these days.
Okay, okay.
And I think it would mainly related to not just sedentary lifestyle, also the sort of food that we are
Food
having these
habits,
days.
yeah, yeah.
So most of the food that we are having, all these burgers and everything, they have less fiber, or in fact, I would say zero fiber content.
Wow.
So all this is causing more and more fat to be accumulated within the liver.
Yeah, and moreover, ordering from Swiggy and Zomato has become so common
Yes.
these days. Like, people are becoming more and more lazy to cook at home.
Yeah. The thing is, once you cook at home, there is you're cooking for someone you love. There is less oil you use and better oil that you use. You don't use reused oil and
Ah.
everything.
Hmm.
Once you order from Swiggy, Zomato, and all these ordering apps, their main focus is to make more money.
And doctor, like, what are some early signs that people can identify that they have some serious problem related to stomach and intestine?
As far as serious gut issues are concerned, there are certain signs that people should never ignore. So one is unexplained loss of weight.
Oh.
So you're not dieting, you're not doing any regular exercise or anything, but you're losing weight without you knowing what is the reason for that. Definitely you should consult your doctor. Other is loss of appetite. I mean, the food you used to love previously, you're not able to eat. You don't have an appetite and you're losing weight. The other thing is early satiety. Suppose you're having 3 idlis a day for breakfast. Now, with one idli itself, your stomach feels full. So that is a major alarm that there is something wrong going on inside. Other things which is commonly ignored is constipation. A lot of people just keep using laxative for years together, and sometimes they come with very late stage colorectal cancers and everything. So constipation is another thing that you should never ignore. And unexplained jaundice. So these are some of the signs I would say you should never ignore when you are having them.
Okay, if they have these signs, they
Yeah.
should immediately visit
Yeah, there is no
gastroenterologist.
scope for delaying it.
Yeah, because like something might be damaged.
Yeah, something more serious might be there. So
Oh.
it's better we pick it up early.
Correct. And doctor, regarding this ulcers, like stress ulcers especially, like, is it true that these ulcers, stress ulcers, are caused by having a lot of stress in their lives?
Both yes and no. See, our stomach has a protective lining, mucus layer, which protects the cells of the stomach. And we know that the acid production happens within the stomach, and the stomach is able to withstand a very low pH. Almost our acid pH within the stomach is 2. So this protective lining is very important to prevent ulcer formation. So as far as stress is concerned, most of the time stress doesn't directly cause ulcers,
Okay.
as long as this protective barrier is intact.
Hmm.
So the things that you do associated with stress might cause ulcers, in the sense that if you are someone who's having chronic pain, chronic backache or something, and you're self-medicating yourself with painkillers, that disrupts the barrier, the protective barrier that is there. Other thing is that people who have a lot of stress, some of them resort to other habits, like they go have a drink, or some of them who are into smoking, they smoke. All these which are associated with stress, this will disrupt the protective barrier, and that makes them ulcer prone. So stress directly may not cause ulcer, but the things that you do associated with stress, especially when you're stressed, you don't sleep well.
Correct.
So your body needs sleep for itself to heal. So your lining, whatever the gut lining, gets replaced, renewed every 2 days. 1 to 2 days, it gets renewed. So for this, body needs adequate rest. So most of the regeneration and the repair happens during the night time when you sleep. So when you're stressed, obviously your sleep is also coming down. So which means whatever the protective layer that has to be renewed every couple of days, that is also not happening properly. So all these can attribute to forming ulcers.
Okay. And is it also true that, like, if you eat a lot of spicy food for years and years, like people will be eating pickles and too much spicy food and all. So is it true that they are more prone to ulcers?
eating more all these pickled and salted foods are proven risk factors for gastric malignancies. To have all these salted foods for a long time is actually not recommended.
Okay.
So many studies have proved that. As far as spicy food is concerned, spicy food in moderation is what we would recommend. As such, it doesn't directly cause ulcers, but in a long term, it increases the acid secretion, and it might reach a stage where the gut barrier is not good enough to protect itself from ulcer formation.
And doctor, like you were mentioning about like constipation, right?
Yeah.
So what might be the reasons? Because a lot of people, like majority of the people will have constipation. Like I think 1 in 3 or 1 in 5
Okay.
might have constipation. So what might be the reasons for constipation?
I mean, as such, as you grow old, the gut motility comes down. So constipation is quite common in elderly. What you should be really worried about is a recent onset change in your bowel habits. Suppose your frequency is once a day or once in 2 days. It changes to once in 3 days or 4 days. That is something which should be sounding an alarm to you. And the main reason for constipation these days I would say that it is the low fiber content that we are having. So most of the fast foods that we have, the burgers and all that, almost has zero fiber content. So unless the fiber rich diet promotes fast motility and promotes the gut motility, and the motion goes in fast. So having a low fiber diet and not having adequate hydration would be the number one cause for constipation. And in case you are having a recent onset alteration in your bowel habit, it is highly recommended that you consult your gastroenterologist, and most people will need a colonoscopy to see if there is something else which is causing the obstruction or something. And few people have functional disorders of the bowel also, which can cause reduced motility, which needs treatment in that.
Okay. And doctor, this a lot of people will also be having bloating and flatulence. And there are some people who have consistent bloating in their
Yeah.
life, but they don't take it too seriously. So there are those kind of people also. So do you think bloating, flatulence signifies an underlying gut issue, serious gut issue?
Not always. Occasional bloating, occasional flatulence is normal, especially you're having a very high calorie diet, and having some bloating is accepted. But if you're having persistent bloating, which is there for more than 2 weeks, then you should get yourself evaluated.
Okay.
So there can be multiple reasons for that. So that needs further evaluation.
Can it be due to foods? As these days we have been hearing like you should have dairy free foods and gluten free and all, because a lot of nutritionists have come up with this concept like dairy can cause bloating, flatulence and all.
I mean, dairy can cause all this if you are lactose intolerant.
Only lactose
Unless you are lactose intolerant, I wouldn't say that not to avoid dairy totally.
Okay.
And a lot of us become lactose intolerant as we age. So maybe in the later part of our lives, maybe we have to avoid dairy to some extent. But as such, it is not a one size fits all kind of prescription for all.
Yeah. And moreover, like I think a lot of Indians might not be lactose intolerant, like at least up to certain age.
That is not true, actually.
Okay.
A lot of lactose intolerance is coming in these days.
Okay. You are getting cases.
Yes. Basic thing is that you need an enzyme called lactase for digesting these daily products. And the levels of lactase go down in most people after 50s or 60s. So beyond that, when your lactase levels are low, then you might not be able to digest these dairy products as well as a normal person does. So in such cases, you can go for alternate things like almond milk or something like that.
And doctor, like these days with a lot of social media and all these mobiles and all, so a lot of people are sleeping very late.
Yes.
So do you think there is a link between sleep and this gut issues?
I mean, there is something called as the gut-brain axis, so which is proven these days. So your gut and your brain are talking to each other all the time when you're sleeping. So that is the main time where this interaction happens. So melatonin is something that is required for your sleep. And one of the major stimulators for that melatonin production is the serotonin. And 90% of the body serotonin comes from your gut. So if you sleep less, there is less melatonin. So both are interrelated. If you sleep less, your gut produces less serotonin, your overall mood, everything comes down. Your gut becomes more prone to inflammation. and in turn it will affect your sleep. So it is like a vicious cycle. So if your sleep gets disturbed, your gut gets disturbed. Your gut gets disturbed, your sleep gets disturbed.
Oh, I didn't know this actually. Like during sleep, gut
Yeah, that
secretes
is
a lot of serotonin, and I
yes,
don't
yes.
know
Most
this.
of the gut-brain interaction happens when you are at rest,
Oh.
especially at night.
Hmm.
So when you bring down that time from ideally around 6 to 8 hours of sleep that ideally you should be having, you bring it down further and further. This is not happening, and that shows up in the way you behave the next day, the sort of mood you're having, and the sort of all this flatulence and everything is all interrelated.
Okay, so if you like, there is a chance if they adjust their sleep, a lot of gut issues can be.
Yeah, the main issue is the screen time that we are
Yeah,
having.
yeah,
So,
yeah.
at the time when your body is trying to secrete this melatonin, you're overstimulating yourself, and that reduces your quality of sleep also.
Yeah, yeah. And moreover, like melatonin is not secreted if there is a lot of light or something.
Yes, that is true.
Yeah, that is also there. So, like, looking at
Yes,
your
some amount of
mobile.
darkness is required. So
Yeah.
all this artificial light, the screen time that you're spending, all this will bring down the level of melatonin.
Yeah.
Maybe that is one of the reasons most people struggle to get into sleep. Take hours together to get sleep and all.
Yeah, yeah. That's what indirectly, like, we are thinking we are engaging ourselves, like we are being active or something, but indirectly you're stopping all the good hormones.
Yes.
To get people think they are watching happy reels or whatever thing they are watching happy things, but indirectly they are stopping their own system from secreting happy hormones.
This mobile technology is a wonderful thing that we have got these days, but I think we are not using it to the right thing. Maybe we should have fixed hours where we'll be using the mobile phones and laptops and everything. And there should be a work-life balance also.
Correct. These gadgets should not be used at the cost of our own health.
Yes,
and,
what has come for our benefit should not damage our own health.
And doctor, like, why are gallstones more common in women?
The main thing is the hormones. There are two main types of gallstones. One is the pigmented stones, the other is the cholesterol stones. So the high estrogen level increases the amount of cholesterol that is produced within the liver and the amount of cholesterol which is getting secreted within the bile. So this gets concentrated and more cholesterol stones are formed. So as such, these days gallstones are getting quite common in both the genders, but the estrogen, the hormones are the main reason why women are more prone to this thing. Previously, oral contraceptive pills also used to be attributed, but these days we have low estrogen OCPs which are being used. So that is not a major factor. Even pregnancy is a high estrogen state, so that can also precipitate gallstones.
Okay, because of the female.
Yeah, even in our medical school previously, we used to be taught about the fat female of 40, which is the ideal this thing, but these days even in the younger generation they are getting
gallstones. Okay. Yeah, recently someone in my family also, they got operated, like she's younger than me, but she got operated for gallstones. And sedentary lifestyle also could be a reason, because she's a software engineer and she sits for long hours, and she also mentioned that she doesn't drink a lot of water also. The
hydration is not related to the formation of gallstones, but definitely the lifestyle, the high fat diet, high sugar, which is there, will the more sugary drinks and sugary diet that you are having, more cholesterol is produced within the liver, and more of this gets precipitated as cholesterol stones. So that can definitely contribute.
Even if they are little overweight and all, that also can be a
that is not a proven this thing, but as such the high calorie diet can cause
people who are lean also can get gallstones.
Yes, definitely. There's multiple factors to this, but this is one of the factors.
Okay. And so if people have this gallbladder stones, and if it is too extreme, so some people get their gallbladder removed, something called cholecystectomy or something. So once that is done, does it affect their digestion and absorption for their...
No, this is one of the most common questions that I get asked. Almost in every OP, I get these questions. So removing gallbladder doesn't affect your digestion in any way. So what the gallbladder does is the other question that people ask. The gallbladder temporarily stores some amount of bile which is getting secreted from the liver. The rest of the bile, as such, it flows directly into the intestine and helps with the digestion. So we don't remove the gallbladder for every person who has gallstones. Only if the gallbladder stones are causing some symptoms, or it is causing some complications. By complications, I mean the stones have slipped, causing some jaundice, or it has blocked the pancreatic duct, causing severe pancreatitis, and or patients are having some abdominal pain or bloating related to the gallstones. That is the only patients that we prescribe removing the gallbladder. So in such patients, as such, the gallbladder is not functioning well.
Okay.
So already within the body, that organ is not functioning, and keeping it for further is increasing the risk of infection and further complications that are associated with it. So removing a diseased gallbladder is not going to affect you in any way.
Okay.
And the digestion, which the gallbladder is already not, which is diseased, it's already not contributing to your digestion. So getting it is removed is not going to affect your digestion in any way.
Okay. So, but are there any diet restrictions they have to take care?
Immediately after surgery, maybe for a couple of weeks, we might ask for a low-fat diet and all those things. But after that, they can have a normal diet and everything.
Okay,
There are absolutely no restrictions.
No diet restrictions. And doctor, regarding this pancreatitis, infection for pancreas and all, like, is there any link between lifestyle, bad lifestyle and having this acute pancreatitis kind of thing?
I mean, the major cause for acute pancreatitis is alcohol. One is gallstones, other, as far as lifestyle is concerned, alcohol is a major thing. So previously, in the previous generation, alcohol used to be considered a taboo. But these days, it is being well accepted. We have pubs and everything getting opened each day.
Yeah.
So it is, alcohol consumption has become quite common in the youth these days. So alcohol is a major trigger which can cause pancreatitis. And pancreatitis can occur in different kinds of severity. There are 3 grades also. There is mild, moderate, and severe. And we don't know which kind of patients get which kind of pancreatitis, whether they will get a mild attack or a moderate attack or a severe attack. If you get a severe attack of pancreatitis related to this alcohol consumption, it is so serious that people, a lot of them require ICU admission. They have multiple organ failure, even mortality, death is also associated with that. So alcohol is a major factor. Another one which is quite underrated is smoking. Smoking also releases certain toxins which has a direct effect on the pancreas. Thirdly, high calorie diet, high sugary drinks and all those things can put your pancreas on overload. So the more calories you are having, the pancreas is having to work overtime, produce more insulin so that all this gets absorbed and all this. All this puts a stress on the pancreas, and these are some of the common things. Hypertriglyceridemia, high triglyceride levels, that is also a risk factor.
Okay. So all these, so indirectly like unhealthy diet and unhealthy
and this
lifestyle.
repeated attacks of pancreatitis will eventually permanently damage the pancreas, which is required for, it is not only for digestion, but it also has, it secretes hormones like insulin and glucagon, which is also quite essential for you.
Yeah. And doctor, like we have seen that Steve Jobs, he died because of pancreatic cancer. So is there no cure for pancreatic cancer? Because when it comes to money and the treatment modalities he can avail, like it's approachable for him, like all kinds of best treatments he can have. But still he died because of that pancreatic cancer. So like what do you say about that?
I mean, pancreatic cancer is treatable, but it depends upon what kind of pancreatic cancer you're having and at what stage of the disease that you come to the doctor. So if picked up at an early stage, it is curable. And it is quite an aggressive disease as such, pancreatic cancer. So it has to be picked up early. If not picked up early, it is there is always chance of, the tumor has already gone into a stage where it is not curable, or there is high chance of recurrence as well after treatment.
Okay. Otherwise, there is like if early diagnosis.
If diagnosed early, it is quite treatable.
Quite treatable.
Yes.
Okay.
And you just have to be under regular follow-up after the treatment.
And doctor, and one more thing, like colon cancer.
Yeah.
These days, a lot of people are having colon cancer. So, like, how common it is these days, and is there any age? Because I think, as far as I remember, colon cancer is like after 60 or after 70 only people are prone.
That is no longer true these days.
Okay.
So when I was doing my MBBS days, when initially you get taught in the clinic's bedside, the first thing that you're taught is at this age group you have to suspect these diseases.
Mm.
So colorectal cancer was something that was taught to me at that time, that somebody in their 60s or 70s, you should be suspecting if they have these symptoms.
Correct.
But these days, youngsters as young as people in their 20s are getting colorectal cancer these days. And India, it has now become the fourth most common cancer. And the unfortunate thing is the younger population who are getting colorectal cancer, it's quite aggressive as well. Some of them come in the later stages also. So it is becoming quite common, and the reason being the lifestyle, I would say that's the main reason, the low fiber diet that we are having, and the highly processed food, obesity, all these things, alcohol consumption, all these are risk factor which has increased the incidence of colorectal cancer these days.
As you said, younger people, how can they, what are the signs and symptoms that they can find?
I mean, the major sign is any change in their bowel habit.
Bowel habits.
Yeah, that is the first thing that people should be cautious about. Suppose any change as such in the consistency, in the frequency, any changes that you notice, you have to consult your doctor immediately. Other things can be some mucus secretions in your stools or bleeding while passing stools.
correct.
Most of them pass it off as piles, which is the common thing. So they go to local practitioners and they just keep getting treated for piles unless they reach a stage where the growth has become too big that they are not able to pass the motion anymore, and such kind of stages. So any alteration in your bowel habit, any bleeding while passing stools, all these things should require a colonoscopy and a further evaluation, definitely. Some amount is attributed to genetics, but a lot of this colorectal cancer is preventable with a lifestyle, this thing. And if any of these signs are there, if you have an early consultation, it can be picked up early and can be treated.
Can be treatable.
Yes.
Yeah. I was about to ask this also. Is it genetic and all? Because I've read somewhere.
Yeah, some amount of colorectal cancer is genetic, but those people, like if somebody in your family is having colorectal cancer and they have had this cancer before the age of 50 years, definitely you should have a genetic screening done if you are at a risk of increased risk of colorectal cancer. And if any of these genetic markers come positive, we have certain recommendations. By a particular age, you should be on a regular screening schedule.
Okay.
So we can maybe, if suppose your family member has colorectal cancer at say 40 years, probably you should be started on your screening by 30s itself. So that we can pick up if there is anything, any sort of polyp or anything, any changes in the colon that we should be worried about. We can detect it early and probably treat it early as well.
Okay. And even stomach cancer also, because I've seen one of my friend long back, like 15 years back, one of my friend, he expired because of stomach cancer, genetic, family they had, and his sister also died because of stomach cancer. It was like purely genetic stomach cancer. So like, is there like, do people come to you for stomach cancers and all?
Yeah, definitely. If you're having a family history of a gastrointestinal malignancy, definitely it is better you consult your gastroenterologist early, because they might, we will be able to suggest certain genetic markers, and we can prescribe what kind of a screening schedule you should be on. So people who have a family member with a gastric cancer or a colorectal cancer, there can be other malignancies also which are more common in them. Like those with Lynch syndrome, they have both gastric and the colorectal cancer. They also have associated endometrial cancer and ovarian cancer risk. So all these can be screened at an early stage. So the treatment also becomes easier, and probably it is curable also.
Maybe now much better treatment methods have come, because 15 years ago they were like in Hyderabad and proper medical treatment, multiple time surgeries, but again they could not survive the disease. So
the key point, take home point would be that if you have a family member who is having a gastrointestinal malignancy, it is probably better that you get yourself screened.
And doctor, how good is intermittent fasting?
Okay. As far as intermittent fasting is concerned, it definitely has health benefits. It is proven to lower your cholesterol levels, your overall cardiac health, and the entire your gut health. Everything is improves with intermittent fasting. But the problem is whether people do it right or not. So that is the major issue. So the current intermittent fasting recommendations, they recommend a basket, this thing that you have to fast for 16 hours and you can have a break for 8 hours and all that. So what I would suggest people is that they should start with a smaller interval. First thing is that you should consult your doctor whether you can do this
Correct.
fasting.
This is very
Especially
important.
people who are
Yes,
diabetic
yes.
and all that, if they go for intermittent fasting,
Yeah.
they can go for severe hypoglycemia and all that. So there are certain group of people who should not be doing it.
Correct. This is
So
important.
first and foremost thing is that you consult your doctor and see whether you are a candidate for this intermittent fasting. The next thing is that you should start at a smaller interval. Maybe you start this fasting for 8 hours or 10 hours instead of straight away going for 16 hours and all that. Another common mistake that people make is they don't get themselves hydrated. So whatever the fasting that you do, you have to make sure that you have at least 2 to 2.5 liters of liquid water, and maybe you can have some buttermilk and all that. People who don't get themselves hydrated, they can even have severe electrolyte imbalances and all those things.
Yeah.
And the other thing is that your gut microbiome, as I explained earlier, it needs a variety of fibers. It needs a constant supply of nutrient so that it can maintain itself. So the sort of diet that you have after breaking the fast is also equally important.
Oh, okay.
So it is important that you have a mix of fibers, a mix of fruits, vegetables, adequate lean protein within your diet. So and also you should have adequate amount of micronutrients and minerals and all that. So whatever diet that you are having after breaking this fast should be balanced.
Okay.
So unless you do that, you might have severe nutrient deficiencies or can lose serious muscle mass and all those things. So intermittent fasting as such is good, but it should be done right, and you should know whether you are a candidate for it or not.
Yeah, under a specialist, like first they should consult a gastroenterologist.
Yeah, first thing is whether each person is different, each person's health composition is different. So to tell that this particular recommendation holds true for all individuals is not correct.
And then under under a nutritionist or whatever, their dietitian or whatever, they can
yeah, definitely. And if you're feeling too hungry, there should also be something that can break your fast. Like if you're too hungry at night or something, you should be having some fruits. The other thing is that overall it should also be fun for you. I mean, you should not torture your body. So if you're in the earlier days of your starting intermittent fasting, if you're feeling too hungry at night or something, there should be something to break your fast also, like some nuts or some fruits, or if you're not lactose intolerant, some amount of curd and all those things. And people who are more prone to acidity, reflux disease and all should not try this intermittent fasting.
Okay. Yes. And doctor, like a lot of people will be having this reflux esophagitis kind of problems. Like whenever they eat some food, they'll feel that food coming up and some sore taste in their throat and all. So why does this happen and all?
So basically there is a sphincter called the lower esophageal sphincter that is acting like a door between the esophagus, your food pipe, and the stomach. So that should stay shut as long as you're not swallowing anything, and it should open when your food is passing through. So for some people, the sphincter, it is not closing properly, it is lax. That is the main reason why the acid which is there in the stomach gets reflexed into the esophagus. And the stomach lining is specialized to withstand this kind of low pH of the acid. But our other parts of the intestine, like the esophagus, is not designed to withstand this kind of acid. So when it gets reflexed, it sort of damages the lining. So the major contributing factor is obesity is one of the major reasons. Other is the food habits that you have. If you're having high calorie diet and all those things can also contribute to reflux. And as such, for some people, the sphincter is too loose or something like that. In such cases, sometimes we need surgical intervention as well, where we wrap the part of the stomach around the esophagus so that the sphincter gets reinforced.
Okay. So like if a patient has this problem for long term, like if they're suffering from this problem for long term, again, rather than taking just antacids and soothing like syrups, like Digene and all, it's always better to consult a gastroenterologist. And like, what kind of treatment methods do you suggest for them?
I mean, the first thing is that if you're overweight or obese, first thing you should uh, start your fitness routine and reduce your weight. So reducing your weight can improve this reflex symptoms. That is one thing. Second thing is that if you're having the habit that you have your dinner or your lunch and immediately you're lying down, that is also a major uh, cause for the reflex disease. So I would say at least a gap of 2 to 3 hours after you have your food is mandatory. And the third thing is that for sometimes some patients who are having severe reflex, we ask them to elevate the head end of the bed so that whatever the reflex, severe kind of reflex doesn't happen, it helps the acid to go back down and all those things. If you're after all these methods, avoid spicy food, avoid high fat diet, all these can cause the sphincter to be lax and cause more reflex. So after you have tried all this, if you are having persistent symptoms, then you should consult your gastroenterologist. We have certain things called like pH manometry study where we assess the severity of the reflex, and we can even know like till what time you are having the reflex. While sitting, are you having more reflex? While standing, you are having more reflex. What is the composition of the reflex? More liquid is getting reflex back, or more solids getting reflex back. Based on the data, all these data that we have, we can prescribe first some proton pump inhibitors or other things to reduce the acid level and see whether it improves. And there is a particular score also that we get called the Demister score from these studies. If it is too high, sometimes we'll have to prescribe surgery. Just these measures might not be enough. We have to do a surgery so that we reinforce the sphincter.
Okay.
So that would be the way to go about.
So after this surgery, like they will be free of these kind of symptoms.
Yeah, if first thing we have to assess whether the patient is a surgical
It's suitable
candidate.
for surgery.
If it's a surgical candidate and if we feel that it is going to help them, definitely surgery will help them. And we also have endoscopic procedures also, which are equally good for some patients. This endoscopic procedures also, we can create this wrap.
So it can be done in daycare, like whoever is like worrying surgery.
Once it is done, probably in a day,
one day
you can
24 hours at
yes,
least.
Yes. The next day itself, we can start you on normal diet and everything.
Okay. It's not too complicated kind of procedure.
No, we can do it in laparoscopic surgery or robotic surgery itself. We can do it these days, and endoscopic measures are also available these days.
Doctor, I happen to ask like few of our viewers to send in some questions for this podcast. So I'll just read out few questions.
Sure.
So one of my friend has asked, I have acidity on and off. I take Rezo. It will decrease. Is there any necessity for endoscopy or any test? If a patient like me has on and off acidity, what are precautions to be taken?
I mean, as we discussed earlier, I think self-medication is something that you should not be doing. I don't know how long your friend has been taking these medicines. If it has been there for just 1 or 2 weeks, it is fine. But if she has been using it for more than that, definitely she needs further evaluation. Most probably, we will have to start with an endoscopy and see how is the stomach lining, what is the cause for the reflex, if there is any bacterial H. pylori infection and all those kind of things. Those have to be treated first. Yes.
Okay, so it's better to get an endoscopy done.
Yeah, definitely. And taking this proton pump inhibitors for long term has its own side effects. So I would definitely recommend not to take this for a long time also.
Okay. And one more friend has asked, what are the few gut helping foods?
The main thing, as I said earlier, there is something called the gut microbiome within this thing. So for your overall gut health, it is imperative that this good bacteria gets taken care of well. And recent studies show that the best way to take care of this good bacteria to have a variety of fibers in your diet, a variety of nutrients in your diet. That's the best way to take care of this good bacteria. So my suggestion would be to have an overall balanced diet, reduce your sugar intakes, and increase more fiber in the form of fresh fruits and vegetables in your diet. Not to entirely avoid all the carbs and all that. There are good carbs, keep taking good fat and all that, so that the gut microbiome gets benefited, and to have regular exercises along with that.
Yeah, like as you said, good carbs. Yeah,
Yeah.
lot of people has this misnomer or whatever that carbs are totally not healthy, but a lot of complex carbs are so healthy and they are very essential for the gut.
I mean, we need a balance of everything.
Correct,
Some
correct.
people say go on a no fat diet. Even there are certain kind of good fats which are required for your gut.
Correct, correct.
So to totally avoid a certain kind of food is not recommended. I would recommend to have a balance of everything, but have portion control. I mean,
Yeah.
whatever you're having, have it in small portions, but have a variety of those.
Yeah, yeah. Only like keto diets, only protein and only.
That is not recommended,
Yeah,
but
keto
have a
diet.
balance of everything so that you get all you don't go into any nutrient deficiencies and all those
Yeah,
kind
yeah.
of things, and your gut bacteria also gets taken.
Because these complex carbs they are have a lot of prebiotics, like there is probiotics, but a lot of prebiotics
Yeah.
are complex
Yeah,
carbs,
that which is
they
required for
prepare
these
your.
probiotics to actually work.
Yeah.
These prebiotics are also
Yeah.
required.
So
So definitely it has to be a mix of
balance,
everything.
as you
Balance
said,
of
balance
everything.
is
Yes.
very important of
To
everything.
go only on a protein diet, to go only on a low carb diet would actually not be recommended.
Yeah.
To have a balance of everything is what research says these days.
Correct.
It's best for your gut.
Yeah, plate of macronutrients, micronutrients, fiber, antioxidants, everything.
Yeah, a
colorful.
mix of everything and have a balanced diet.
Yeah, yeah.
If you see our traditional diet that we used to have, previously used to have a mix of everything.
Correct.
But right now we are copying the West and our fiber intake, everything has come down.
The reason, as you said, copying the West and fiber intake, the reason lot of stomach-related, gut-related cancers are more in the Western countries, just because of their lack of fiber in their
There
diet.
are some certain good things that we can emulate from the West, but
Yeah,
at the
but
same
not.
time, we have copied all those things that we should not be.
Yeah, and
So sort of lifestyle diseases that the West used to be having 10, 20 years before, the same kind of diseases we are having it now. In fact, I would go to the extent that the West is trying to copy our kind of diet these
I was
days.
about to say this. They are having all our.
They have gone to a stage where they have found that all these are unhealthy and they are looking at us.
Correct.
In fact, to have all those things.
Yeah, there are a lot of people are following vegetarian.
A lot of becoming vegetarian. A lot of the Indian restaurants are doing well in the West.
Vegans, vegetarians, and all. Like I was surprised, like when I was living abroad in UK, lot of them were vegetarians just because of health. They are including lot of fiber into their diet and all.
In fact, they are becoming more health conscious and all their the high calorie eateries, all those things are doing quite well here in India actually.
Yeah, they are even eating our ghee and all, milk, golden milk.
Yes.
Golden milk is nothing but adding turmeric in milk.
Yes.
So, which our ancestors or our elders have taught us.
Yes.
So, all these are good for us. So, better to go back to our roots.
Yes, definitely.
And another person has asked, why do people have burning sensation in chest, though they have meals as per schedule?
I mean, any chest discomfort, first thing is that you should make sure it's not related to your heart. So that will be the first thing that goes without saying. So if you're sure that it's not a left-sided chest pain that is radiating to your arm or any kind of this thing, then the next thing that you should think about is the reflux disease. So if you're having persistent symptoms, if you're having persistent dry cough and all that, it's better that you undergo an endoscopy and see what exactly is happening.
Okay. Thank you, doctor. Thank you for sharing so many things. I mean, like, even I didn't know a lot of things.
Thank you for having me.